time with a mid-facelift, I can do a consistent anterior cheek fill with fat very easily. So again, this is just the re-education and thinking about looking at your face with no flash, no bright illumination, no magnification, but sitting at a social distance from the mirror and judging the face at how you would interact with another human being. All my photography is done with no flash photography because basically that's how we see each other, is sitting in a room with just overhead lights or outside with just overhead lights. Very rarely will there be in-your-face light. So bring in old photographs to try to understand the patient's identity. The principle is not to overcorrect, so you avoid those complications. Start small and consistent. Here's the thing that people have been distraught about in the past. The thing that people have been using fat for is lips and lines. And those two areas fail consistently. Now you can get good results, don't get me wrong. You can go up there and show me some great lips and line results. But it's consistently harder to achieve. So if you look at my before and afters, you won't see much change in the lips and lines unless I did something else. It's more for volume contouring. So if you understand that at a fundamental level, you understand the benefits of fat. So the complementary idea is that we don't have to give up everything. We can use this in combination and accentuate your facelift results, accentuate your blepharoplasty results. What we did in this book, Complementary Fat Grafting, is make it easy. Take some of the artistry level out and break it down into three fundamental levels. An empirical volumetric foundation, which makes it just give you the volumes, give you the how to do it, and then build on that into a refinements phase, and then after about a year, adding maybe some of the advanced concepts that may be higher morbidity in a novice's hands. So this is just an illustration from the book. It just talks about what volumes, where to put them, and how to do it. And this is the refinements phase, and then advanced. There's no bandages, there's no sutures, there's nothing. There's nothing to do, just some ice. So it makes it extremely easy. The only thing I ask my patient is to cut down dietary salt and not to do a lot of excessive bending over of Valsalva. And pretty much they can even exercise the areas I've harvested from. I just ask them not to do a lot of stomach crunches or increase Valsalva. So let's talk about some fundamental aspects of sort of conceptualizing this. Inverting the triangle, flipping that triangle back up. This is a lady that looks almost heavy on the left, but she looks slimmer on the right. So I did take a little skin from her upper eyelid, and this actually brings you back to the concept I brought about yesterday, which is maintaining crease position. I've actually pushed the crease lower. But this is slimming that face and bringing out the triangle and flipping the triangle back to where it should be. Another example, you can see that nice triangularity there, and actually the jawline looks slimmer with no facelift for a 55-year-old. And that no blepharoplasty was performed here, just filling in around the eyes that create a beautiful change. And again, really no change in the lines. I did a little silicone in the lips, so if you see a little accentuation there, that's silicone that is not fat. Eliminating transitions, very important. This gentleman looks feminized, overlifted brow, scar, did a geometric broken line to fix that in the forehead. But if you look at the facial features, there's a blending of all the areas. The bone of the cheek has been eliminated, and even the jowl has been eliminated through fat. There was no brow lifting or any other cutting here. This is a lady that had a facelift, cheek implant, chin implant done elsewhere. And if you see, my fat into the jawline looks better than the facelift. And her cheek implant has actually accentuated the transitions between her above her cheek and below her cheek. So really what the fat has done is create beautiful luminosity and really soften the transition zones. Framing the eye. Let's talk about that again. If you look here, you may interpret that as needing a brow lift or upper eyelid procedure. That's just adding fat. What I want you to focus on is that linear depression where you see that bone. Filling that in, if you look at one thing interesting, I've pushed that eyelid crease down. All the results you're seeing before is pushing creases up. But if you look at a young woman, they have low creases. So pushing that down and creating luminosity in that brow is beautiful. I did transconj bleph and I combine it with a cheek, lower eyelid fat graft. And you can see that that brings the sparkle and volume and luminosity back out. This lady had a brow lift upper lower eyelid. Obviously you say, well, I don't do these kind of things, really too aggressive. And you can see volumizing that, at least getting it back closer to where she wanted to be. I think I've helped at least get back some of her identity. And after 14 months, you can actually start seeing that transition of the skin start smoothing out, which is no skin treatments, no peels, nothing else. To me, that's pretty exciting. And again, look at that skin because there's luminosity. No facelift here actually. The jawline looks better with fat. And you can see 15 months out a really beautiful transition zone. Or I've actually taken, if you think about what I've done with that upper eyelid, I've pushed that eyelid all the way down over the eye. It's the opposite of what you've heard for the last 2 days. I filled and framed that eye. So using old photographs, do I get people closer to their old photographs? The question is, do you? And if you see here, this is a lady that had a brow lift on the left. I did a facelift and I did volume. And you can see that, I know it's not a great photo, there's a little bit orange tint. I imported from Keynote, I'm sorry about that. But if you look, I've gotten the volumes closer to her in youth. Same thing here, this is some bad lower facial work. This is a silicone lip enhancement I did and some lower facial correction and a little bit of upper bleph and fat. And if you look at her in her 30s, look at how heavy that upper eyelid is. Begin to look at old photos and ask yourself fundamentally, are you making people closer to themselves or farther? And if you see a little bit of upper eyelid skin removal, but filling unbelievably that brow, creates a youthful look. And this is all fat grafting. But look at the skin. This is interesting. She's on Accutane. I couldn't do skin treatments. I can't do a facelift. But look at her skin after fat. It creates the luminosity, and there's a textural change to the skin over a year. So improving results. Let's look at patients over a year. Does it get better or does it get worse over time? I want to convince you it gets better. This is a lady that's a facelift fat grafting 1 month out. Looks great, even though she's swollen. 6 months out with no sleep. But look at the brow where I put it. I put it hanging over the eye. Remember that Christy Brinkley photograph? And let's look at her at 14 months. If you look at her, it's maintained and it's actually blended better. There's a unity there in that fat grafting. And look at her in her 30s. I've gotten a 51-year-old lady closer to her 30s. Look at how heavy that brow is in her 30s. Is it high and skeletonized? No. If you look at this, this is about 7 months out from fat grafting, facelift, upper bleph, and silicone into the lips. I actually don't take this much skin from the upper eyelids anymore. But let's look at her here, 7 months out or so. Look at the wrinkles. Better. Now let's look at her about 14 months out. That brow has come alive. The cheek, the transition zones have melted out. And it's blended better. Bonuses. Other things.